Hi, everyone, and welcome back to another episode of Black Excellence in Healthcare, White Coats and Real Talk podcast, the podcast where we highlight true Black trailblazers in the healthcare field. Tonight, I have a phenomenal woman who I'm going to interview, a special guest, but I'm going to go ahead and let her introduce herself.
All right, so my name is Sudi-Ann Lewis-Dawkins. The accent is because I'm an island girl, Jamaica to be specific.
Okay.
Yes, so I have over 8 years in the healthcare field. So my journey started with my bachelor's of nursing degree at the University of the Virgin Islands, that St. Thomas, because it has three islands. And my nursing bedside experience involves the ICU and the IMCU step down. While working there, I did get my CCRN, that's the critical care nursing certification, because at some point I wanted to go to CRNA school. I don't know what happened with that. I can't tell you. But during the pandemic, I wanted to do something more with my nursing license other than bedside nursing. And that was when I decided to go back to school to get my MSN as a nurse practitioner. My license is specifically Adult-Gerontology, acute care, working mostly in the inpatient setting. And that's where I'm at right now.
First of all, that is amazing. And I just want to say I'm super proud of you and congratulations on all of your
Thank you.
accomplishments and NP world.
Thank you.
I love it. I love it. I love it. So where are you now in your healthcare career? Can you discuss any milestones, challenges that you have faced and how you navigated through them?
Okay. So where I'm at now, I currently work as a hospitalist, or most people call attendant for large organizations.
Okay.
And the challenges specifically with that is becoming a confident practitioner. It's a challenge getting out of that nursing mindset, that bedside mindset, to becoming the leader, everyone looking to you for these solutions. So that's pretty much where I'm at. And other than that, I decided to be an entrepreneur and start my own private practice, the Greenleaf Clinic. And the biggest challenge for that is starting, thinking that I could do it, because I've been wanting to do it for a while, but there was a little voice in the back of my head saying, why you? But then I look around, I look online, I see people that look just like me doing it, and I'm like, why not me? So that was the biggest challenge, starting. Yeah.
Okay. So can you tell us about the Greenleaf?
So the Greenleaf Clinic is primarily a functional medicine clinic that manages chronic condition. And functional medicine, it searches for the why in a person's health. It looks at the root causes instead of just symptom management. It looks at the stress level, the environment, the diet, and bring all of that together and create a holistic plan, meaning looking at the whole person to take care of that chronic condition or whatever comes up in that person's life.
That is awesome. So what made you actually wanted to jump into that realm, into functional medicine?
So working as a hospitalist in the hospital, the readmissions rates, the individuals coming not knowing a lot about their chronic condition, COPD, diabetes, high blood pressure, and I kind of stumbled up on functional medicine out of frustration, wanting to find out more, because I did not feel like I was helping these individuals after I patched them up in the hospital and they walk out of there and they will come back. So during my research, I found out functional medicine and it clicked with me. And I decided to pursue that route for my own private practice.
That's awesome. And that is most definitely needed because in our programs, in our nurse practitioner programs, functional medicine is not introduced.
No.
And I think it should be, introduced because that is very important, finding out that why,
Yeah.
so it won't be a revolving door for patients to keep coming in, rehospitalizations, and just getting to the root cause. So kudos to you because that is most definitely needed, especially with chronic disease management. Functional medicine is very important. And I'm starting to see it more and more now, which is very intriguing to learn more about it. So kudos to you again. I love it. I love
Thank you.
it. So can you share a time or like a patient story or an example of where you like uncovered the root cause that like led to a major breakthrough?
Okay, so one story that still sticks in my mind to this day was a young individual coming to the hospital readmitted for small bowel obstructions. And the readmission, at one point, it turned into them having to do surgery for that small bowel obstruction.
Okay.
And it took us being tired of the trend to dig into her history, her lifestyle, and getting a consultation with a gastroenterologist to figure out that she has IBD, irritable bowel disease, to get the workup done. And
Mhm.
that is where functional medicine comes in her future, because now that we have a diagnosis, instead of just patching her up, focusing on symptom management, we look at her, the whole her, can address her lifestyle, her diet, and ongoing management for her IBD. Yes.
That's awesome. That I love to hear stories like that. I really do. It's just so inspiring, and it kind of just remind us of why we do what we do.
Mm,
And I think that's what set providers apart from being good and being the best. Really like diving into deep as the why. That's which leads back to that functional medicine again, which is really
yes.
really important. So, what does Black excellence in healthcare mean to you,
Ooh. Uh,
personally and professionally, or all together?
yeah, that's a big one. So Black excellence in healthcare means showing up, because you're going to be stepping into rooms where a lot of times you don't see anyone that looks like you. So that's what it means to me personal. Going there, showing up. Professionally, it means trust. You have a lot of people that look up to you, patients and as well as team members. So you have to put on that coat and be that trusting person for them. So yeah, showing up is my biggest thing. Showing up. Mm.
Yeah, that is a big thing. You do have to show up.
Yes.
You can't presume excellence or without at least showing up. Yes, I agree with you. So, what does the white coat symbolizes for you as a nurse practitioner? What does that represent for you personally, professionally, and maybe even culturally too as well?
Yeah. So, to be honest, for a while for me, I did not like to wear my white coat.
Okay.
Yes, because I
Tell us why.
felt like it was a symbol of something that I wasn't ready for or I couldn't stand up to. So that's where the imposter syndrome came in.
Mhm.
I felt very uncomfortable. But over time, with experience and being a representation for individuals seeing me, I decided to put on that white coat to represent people that may not be in the space that I am, that someone could look and say, oh, she's there. I'm going to do it too. Yes.
I love that you was completely honest about that.
Yeah.
I mean, I really do love that. And sometimes, when people see us with these white coats, they hold us to a high standard. But at the same time, we humans too. And we have feelings and emotionals too. And sometimes we do go through like the imposter syndrome. Like, am I good enough? What does this, really symbolize is,
Mhm.
not just for us, but for other people too as well. Being in this white coat and being in that leadership position, it kind of holds you at a higher power, right?
Yes.
Where, not only your team, but patients and families is also, looking up to you as well, especially for answers, especially for caring for their loved ones or caring for them too, as well. But I just really, really like how you was completely honest about, not even wanting to wear the white coat at
And
first.
not even want to wear it because I don't know if I could do this. Like, do
Hmm.
I have it in me to represent what the white coat means, basically?
Right.
And for a while, starting out, I didn't feel like I did.
Mm.
But I did the school and I stayed up the nights. I struggled and just thinking about all of that. Like, you gotta wear that white coat. Yeah.
Yes.
Yeah.
Yes, you worked hard for that. You earned that white coat.
Mhm.
And I'm sure it looks lovely on you too as well.
Yeah.
So
Yeah.
that is completely awesome. Did you experience like being a Black woman, being in healthcare, like any challenges like, going through school and things like that, with school? Yeah.
Like, so for me, it was, of course, being the Black woman and then how young I looked. I was one of those that did felt so uncomfortable when a patient would ask me my age. I would try to avoid the question, but when I would tell them my age, tell them my title, the look on their face, it did hurt. And that was one part of the reason I decided to start wearing makeup to work, to look
Hmm.
older.
Okay, that's
Yeah,
interesting.
yeah.
That's a first. Now, we be trying to look young and you want to look older.
Yeah, I had a patient that told me I look 16 once.
Really?
Yes, as a
Wow.
nurse practitioner. So it in a space like that, it gets
Hmm.
uncomfortable when you're trying to be taken seriously.
Hmm.
When a majority of individuals around you are older, that's been there for a while. So that was my challenge, navigating the nurse practitioner world.
Okay.
Yeah.
Well, you did it. You did it. Looking
I'm
young and
doing
all.
it. I'm doing it.
Yes, and you're
Yes.
doing it. Still
Yes.
looking young.
Yes.
That's truly a blessing. That's truly a blessing. I would have took that as a compliment.
You not when you're trying to discuss serious
No. So
things.
they probably say, well, you old enough,
Yeah,
you young enough to
exactly.
be my
Even my grandchild.
grandchild. Ooh,
Yes,
not even the child,
yes,
grandchild.
yes. So that was
Well, that's awesome. That's awesome, and that's a good experience too as well, because now you do see a lot of nurse practitioners, younger and younger actually, in those spaces, and that's good that someone probably listening in and being inspired, probably another young nurse practitioner who may feel the same way. Because I had a couple students, and they actually have that same concern, like, oh, they think I'm too young, and they think I can't
yeah,
do what I'm supposed to do, and I was like, you just gotta carry yourself with confidence,
yes,
carry yourself with confidence, and let them know that you belong in their room,
exactly.
you
And
earned that title, and you know
yeah,
what you're doing,
and
right?
yes, definitely. And the biggest fear is that people are going to discredit you because
Hmm.
of how young you look. They don't
Hmm.
take you as seriously. So that was my challenge navigating all of this. Yeah.
Yeah. So when did you come to America?
So, I'm Jamaican born and I grew up in the US Virgin Islands. So that's
Okay.
where I did middle school, I did high school, and then the University of the Virgin Islands. And then I came to America after college. Well, America. mainland. After college, yes.
Okay, that's awesome. Did you participate in any sororities or anything like that in college? Or any like organizations or groups?
Yeah, yeah, here and there, but no major sorority.
Okay.
Yeah.
No, me neither. No.
Didn't have time for that.
No, especially when you at nursing school, you barely got time to, for
Mm-hmm.
you ain't got time for nothing really. You barely had time for
Mm-hmm.
yourself. So I do understand. I do understand that. So on every episode, I do a thing called White Coat Confessions.
Oh. Mm.
Well, we kind of get up in your business just a little bit. So White Coat Confessions is basically sharing like a personal or professional truth or like a lesson learned or a surprising aha moment or like an untold story that has shaped you into the woman you are today.
Mm. So I guess my professional is overcoming the fact that you're not going to know everything. Every day when you work, you come across something that you don't know.
Mhm.
But it's how you respond to that. If you're arrogant and you said it's not important to learn and you just brush it off, it's going to come back up. But it's just for you to look it up. There's nothing wrong in looking up something in the middle of the workday. That's why they give us up to date for free at work, right? Yes, that's why they give us that. So we're not going to know it all. You know, in nursing school, they tell us to tell patient, well, I'll be back. You could do the same thing as a nurse practitioner. Go look it
Mhm.
up. Ask a colleague for help. And that too, asking colleagues for help because you're not going to know it all. And that was what I had to overcome because when I first started, when something came up that I did not know, I felt incompetent,
Mhm.
honestly. And I guess it's just that pressure on myself that I should know it all. But now I'm comfortable with hey, you don't know this, go and look it up. Go and ask someone. Because they're not going to look at you like, I hope they're not looking at you like, oh, she don't know what she's doing. I hope
Mhm.
they will help you. So that's my confession, not knowing it all and researching.
Yeah, that is extremely important. And I tell my students like, don't have an ego or feel too proud or feel like you incompetent because you asking questions. Because it's best to get some help or
Mm,
research, the answer as opposed to just doing something that you think, oh, because I just need to do something to get it done.
exactly.
And that most definitely is not the way to practice. Learning is lifelong. In healthcare, of course, we're going to experience something every single day. We're like, what is
Yeah,
that?
I never. Yes.
And it's okay. And it's okay to look things up. It's okay to ask colleagues their input. All of that is okay. That just makes you a better provider so you can make sure that you're doing the right thing for your patients, right?
Exactly. I agree.
Okay, that is awesome. Anything in your childhood experience you would like to share that kind of shaped you into who you are today?
Shape me into who, like nursing, medical.
It don't even have to be medical. It could
Uh,
be just, an experience, like a childhood experience, or maybe something that you, experienced during childhood that kind of shape you into or change your thought process about the woman that you are today.
Hmm, that's interesting. I never actually thought about that. So, growing up for the short period of time in Jamaica, it was just hard work. So, that's where I came from. Hard work, trying to get, I guess, get out. Growing up in a third world country. So education has always been the top of my priority list. And that just stuck with me until I became an adult, which is still is, because I am a lifelong learner. I'm always doing something with school. Even now, like I complain, but I can't stay away from learning something, which is good. So it's just the discipline that started out in Jamaica that stuck with me until now.
That's good because education is very, very important. So, knowing that the woman that you are today, all the accomplishments that you achieved, what would you tell your younger self today?
Hmm. What would I tell my, well, see, I told you, basically. Yes. Because the not believing in yourself that you could do it. I have, well, I had a lot of that. So I would tell her, see, I told you, it's gonna be okay. Just continue doing what you're doing. It's gonna be okay. Yeah.
Oh, that's so sweet. I love it. I love it. I get people with that question. They be like, oh,
Oh,
wait, what would I tell my
I
younger
never
self?
thought of that.
But that is awesome. So, what is like a piece of advice that you would give for someone that want to, go into healthcare or, want to become a nurse practitioner, or just a piece of advice for the future generation in general?
hmm Hmm. Interesting. A piece of advice would be, just do it. You could do it. If I could do it, you could do it. Like, what makes me different than you? I was in your position once. I doubted myself. I didn't know it all, but I kept on doing it. I was consistent. So do it. Someone behind you is looking at you to do it so they could do it. Just like you're looking up to me. There's
Mhm.
someone behind you. So continue that train. Just do it. Continue. Yeah.
That is some good advice. Because sometimes, and that's one of the reasons why I started this podcast, is so our future generation, not just our future generation, but our generations right now, to see that this is possible. This is possible. And that with hard work, you can accomplish anything. You can accomplish anything. And sometimes people feel like, or they allow people to kind of put them in a box.
Mm,
And I always tell people, don't allow no one to put you in a box. You can do everything your heart desires. With hard work and dedication, it can happen. And when they see providers with the white coat on that look like them, it's a true inspiration. It's a true inspiration, and it's a motivation for most too, as well, to know that it can be done. They can
mm-hmm.
do it. So I always tell people, pay it forward too. Pay it forward. With mentoring, precepting, nursing students, it's a great thing to, always, give back, because we was in that position too as well
Yes.
once before. So when you pay it forward, you have hopes of when they come up, they pay it forward too as well. Because I say we stronger together, right?
Yes, I agree. That's true.
We are stronger together. So is there anything that, you want to, say to the audience?
Hmm. Ooh.
Like
You just been hitting me with curveballs.
I, like what's next for you? What's upcoming for you? What they should,
Mm,
you know, be looking up to? What's your social media handles? How they can
okay.
follow you? Just let them know like any upcoming projects or goals or ventures you are excited about that you want to share with the audience, and then how can they stay connected with you?
Yeah. So, yeah, I am doing a lot. I am a busy woman. Currently, what am I doing? So, continuous learning. So, I'm currently in school for my DMP. I'm also working on getting that. Yes, gotta get to the top. I already started, right?
Yes.
Yeah, working on getting that functional medicine certification through the Institute of Functional Medicine.
Okay.
Um, so I just finished well, not dabbling, but a genomic course through the NIH to try to get more about genetics and
Hmm.
DNA and stuff. So I just finished that professionally. As far as the Greenleaf Clinic, you could go on the greenleafclinic.com. I do have a blog. It's called the Wellness Leaf blog, where I share tips, evidence-based data for disease management. So I'm doing that. And then I'm coming out with a book or guide. It's called the Supplements Holy Grail. And it's just a educational guide on helping individuals choosing the right supplements that fit their need. So that will be coming out soon. And on social media, it's the Greenleaf Clinic on Instagram, Facebook, and YouTube, because I'll be doing a lot. I am a busy woman. And to keep up with me to see what I'm doing. Yes.
You're doing some amazing things. Oh
Yes.
my God. I'm so proud of you. You're doing some amazing things. Super, super congratulations on
Thank
you
you.
for, continuing your education, going for that highest degree in nursing. So that is amazing, amazing.
Mhm.
And I wish you well on that journey. I wish you well with your Greenleaf Clinic too as well. And your book. I'm gonna have to get that book, okay?
Yes. You want to know the
um
right supplements to take? I'll tell
Yes,
you.
yes. Because it's so many out here.
It
It's
is.
so many. Like you need some guidance when it comes to,
Like,
selecting them.
yeah, what are you
So
looking for? Weight loss? Well, what are you looking for? I got it. I got it for you. Because I'm into
yes.
that. I've been into supplements for a while. So
Okay.
it's based on personal experience and scientific data that I brought the book together. Yeah.
Okay, that is awesome. That is awesome. I am so, so proud of you. And thank you so much for coming on Black Excellence in Healthcare, White Coats and Real Talk podcast. To my audience, you make sure that you're following this phenomenal woman. I'm sure you're going to gain a lot of insight, a lot of knowledge. I hope this conversation today provided inspiration to those that's in healthcare and also to those that's not in healthcare. Please, please, please make sure that you're following White Coats and Real Talk podcast. You could subscribe on a live podcast network, which is a podcast streaming platform for Black people. You can also subscribe to our YouTube channel, Black Excellence in Healthcare, White Coats and Real Talk Podcast. And of course, you can hear this podcast on any one of your favorite podcast platforms. So until the next episode, stay blessed.
All right. Bye.